Good morning, everybody. It is great to be here. Good morning. Although, as a non-morning person, I have to say it's a little bit of hard for me to be here at this hour, and so I'm just going to. I assume you're all caffeinated. You know, cappuccino, hold the almond milk. And so to wake us all up a little bit, I'm going to start with that food compass that Ivor mentioned. And it really is an astonishing thing. I think in the 20 years that I've been researching nutrition science, I have never seen anything that was so surprising to me as this graphic. So this is not the new government food pyramid. This is a new food rating system. And just look at it. I mean, some of the things on here, green is, of course, eat more of. 100 is a perfect score. Frosted mini wheats up at the top. Honey Nut Cheerios, eat more of those. Almond M&Ms, eat more of those. And altogether, Cheerios is another one not on this graph. It gets 95 out of 100 points, almost a perfect food for you to eat, Cheerios. And it gives also top rankings to Lucky Charms and Cocoa Puffs. Altogether, I counted 70 brand name cereals from General Mills, Kellogg's, and Post were ranked twice as high as eggs cooked in butter. And of course, ground beef is the worst thing you can eat. I thought this was a joke. When I posted this on Twitter and got 1.6 million views, most of the responses were, is this a joke? And you have to think, like, this can't be serious. But it turns out it is quite serious. It comes out of this paper by this individual, Darush Mozafarian, who is the dean of the Tufts Friedman School of Nutrition Science and Policy. And it is his effort to rank what they ranked more than 8,000 foods according to a number of criteria, and this was a very serious undertaking by them. Mozafarian is worth talking about because aside from being the dean of that nutrition school, which is a very prestigious elite nutrition school, it was the mastermind and main driver of the conference last fall at the White House on hunger, nutrition, and health. And he is, I would argue, probably the most important nutrition science and influential nutrition scientist in the US today. So it's worth taking note of this. And I wrote about it. You can just take a snapshot of where you can find that on Unsettled Science, which is my new Substack column where I'm writing things these days. And I'll show that later as well. Here, and I went and looked at the data. So that other pyramid that you saw was actually made by some academic critics who published a paper, and this was, I think, back in early 2022. Then I went back into the data and did my own charts and found this one. These are just General Mills cereals that are in the chart. And again, here we have Reese's Puffs, eat a lot of those. Cookie Crisp, Boo Berry, have you heard of that? Boo Berry. Count Chocula, never heard of that. A lot has happened since I was a kid. I thought Lucky Charms was like the sine qua non of terrible cereals, but it turns out there's more. And Dora the Explorer is another one. Okay, so we're going to talk about this. I'm going to talk about more about this compass at the end of the talk and how they got these rankings and why this represents what is wrong with our expert nutritional advice. Sorry, let me just finish with this one. 9 kinds of Cheerios are on this chart, and altogether 53 General Mills cereals ranked 40 or higher. And again, all higher than eggs or cheese or beef. So my disclosures, I do still receive some royalties from my book, amazingly. But otherwise, I receive no funding from industry, and the group that I founded, the Nutrition Coalition, also receives no funding from any industry. And I really came to this whole topic 20 years ago without any preconceptions. I'm a journalist, and I'm trained to look at all sides of an issue. And I had been a vegetarian or eating some fish, but for over 25 years, definitely no red meat, no eggs, no butter. And I always struggled with my weight. That was me at 18 years old. And I had really bad hair. So let's move on. And I ate according to the food pyramid. I mean, you don't know that you're following the government's guidelines, but we're all following. Any of us who started off doing the following, let me just first say why the guidelines are so important. Why are these guidelines that we grew up on so important? This chart, you might take a picture of it and look at it more closely later, but it really controls, it is the single most influential lever on what we think is healthy and our food supply and what people eat in public settings, like school lunches, feeding programs for the elderly, the military, the way that they serve food in the military mess halls, K through 12 education, and then this group, which I think affects the doctors in the room, all the professional organizations download the guidelines. I've heard many stories of doctors, nutritionists, dietitians saying to me, I can't keep my job unless I teach the guidelines. They won't allow me to teach anything else because it's considered the gold standard. So they're very influential. Even if you think that you have solved your health and that's fine for you, you have to remember that your kids in school, your elderly relative in a nursing home, the people of the military who fight for our country, all of those populations have metabolic diseases and they're all getting government food. What is the guideline to tell you? What is this healthy dietary pattern? It's, even if you don't know it's coming from the government, it's fruits, vegetables, grains, dairy, but only low fat or non-fat, protein foods, which, there's now many more protein foods in this category than there used to be. Now there are lentils, nuts, seeds, soy products. Those have all snuck in over the years. And vegetable oils. It's something like 37 grams of vegetable oils a day. So definitely no butter. And a 10% limit on saturated fats as a percentage of total calories. So, and many of you have seen this slide before. I mean, this is our obesity problem in America. This is correlation, not causation. But we can pair this with a lot of clinical trial literature to show that when people back off the dietary guidelines, they turn the pyramid upside down, they're a lot healthier. But in 1960, our rates of obesity were, this chart is actually, I'm just realizing, anyway, I won't go into it. This chart continues to go up. The rates of obesity, this is overweight and obesity, that's why. Obesity in the United States was down around 12 or 13% back in 1980 when the guidelines started. It is now verging on 45%, maybe we're close to 50. The CDC will not release the numbers. They haven't released the numbers in at least 5 years. Okay. One of the critiques of the guidelines often you will hear is people don't follow them. But just look at this chart. I mean, and I'm going to show you some more charts. We have followed the guidelines in dramatic ways. This is the best available data that is out there. It's a percentage of total calories, which is the way to measure this correctly. Carbs are up by 30%. As we were told, eat more grains. Fats are down by 25%, and saturated fat is also down. We've also followed the guidelines in terms of all the food categories, right? Fresh vegetables are up, fresh fruits are up. We're told to eat more of those. Grains are up. Vegetable oils are up by almost 90%. Those are all the blue lines. All the red lines show the things that we were told not to eat, and all of those went down. Whole milk, eggs, animal fats, butter, red meat is down by 28%. Beef is down by 34%. I'm sure those numbers are even lower now. This is from 2014. So, right, here's another one just specifically on meat and other proteins. You can see we eat a lot more chicken and a lot less beef. And these are the three, so there's supposedly 3 dietary patterns, so you can have choice, but they all look kind of the same to me. And they're all, I think, at least twice as high in carbohydrates as many of us would consider sort of a top level of carbohydrates to maintain health, good health. So in this cover story for the BMJ, which is a pretty prestigious medical journal, one of the oldest medical journals in the world, I wrote this story of I was trying to understand the 2015 guidelines when they came out, because I had just come out of writing a book, and I had read thousands of scientific papers and learned the entire history of the literature of nutrition and health. And none of that was in the guidelines. I couldn't find it. So, and also I wanted to know, why it was so hard to get better on the guidelines. And here's what I found. And it's documented in this paper, which peer-reviewed and has withstood quite a bit of criticism from people who weren't happy. It was the first paper really to seriously criticize the guidelines. Here's what I found. What was the amount of evidence that they had to show that dietary guidelines would help you with weight loss? Right? This is a review that they did in 2013. It's still the current body of evidence behind the guidelines. They haven't updated it. This was their evidence base. One trial on 180 subjects with metabolic syndromes. It went on for 2 years. It tested the Mediterranean diet, and it found after 2 years they lost 6 pounds, compared to the low-fat diet, which we know doesn't work. Okay, that was it for obesity. Only one trial. What about heart disease? Okay, here the evidence base was really complicated, but I'm going to break it down for you. There was basically one trial called the PREDIMED trial, which is the main trial on the Mediterranean diet I'll talk about, and the DASH trials, which is the American Heart Association's diet to reduce hypertension. Okay, so let's look quickly at the DASH studies. This is current as of the time that this review was done. They've been tested on no more than 1,200 people in only almost entirely on hypertensive middle-aged men, only men. So does that generalize to the whole population? I don't know, I'm not a man. Although I might self-identify as one soon. I get more respect. There was only one trial that lasted longer than 8 weeks, and that trial was only 5 months. Think about when low carb is criticized for not having long-term data. And although the so-called bad LDL cholesterol goes down, so does the so-called good HDL cholesterol, meaning that the outcomes at best are a wash for heart disease risk factors. Okay, that's it for DASH. What about PREDIMED? This study has been cited more than almost any other nutrition study, maybe the most. And it came out in the New England Journal of Medicine, but oops, it was retracted and then republished in the same day. Although if you look in PubMed, it's still the most cited trial. It's cited like thousands of times a year. And it's really questionable as to whether or not the results are actually reliable. This was analysis done by Richard Feynman, and it's on his blog post, and he showed that the reduction in cardiovascular events, outcomes, was actually only the absolute reduction in risk, not the relative reduction. The absolute reduction was only 0.02. So it was tiny, tiny benefits. So that's the summary of the data for the dietary patterns and their effectiveness for heart disease. Short-term DASH trials on hypertensive middle-aged men, and one trial that was retracted and showed a 0.02 absolute risk difference. That's it. What about diabetes? Can the dietary patterns reverse diabetes? 0 clinical trials were presented to show that they could prevent or reverse diabetes. What about the vegetarian diet, which was introduced as a new dietary pattern in 2015? They could find no randomized controlled clinical trials to support this diet. And they concluded that the evidence for any disease-fighting powers of this diet was limited, which is the lowest grade that they could give to evidence when there was any evidence available. And still, they promoted it to be a dietary pattern. Okay. What about saturated fats? There must be something that is evidence-based in our guidelines. Well, there's a whole history of what is the story on how we became to believe that saturated fat is bad and what has happened, kind of dramatic change in that thinking over the last 10 years. And if you want to see a review of that, I gave a talk in Low Carb Boca. You can look it up. I also cover at least the first part of that history in my book. But for anybody who just wants to know the state of the science now, this is the best paper to understand, which is that it's in the Journal of the American College of Cardiology, which is a very prestigious journal. The authors include 5 former members of previous dietary guideline committees, so the experts who wrote the guidelines. And this is what they conclude. There is no robust evidence that current population-wide upper limits on saturated fat consumption in the US will prevent cardiovascular disease or reduce mortality. This is a review, this is a review of a huge body of evidence. So they're clearly saying we got it wrong. Then number 4 should be 5. And the article was named by the editor-in-chief as a state-of-the-art review, and he chose it as one of the top papers in 2020. I think this is the most authoritative paper on the data to date, and a good paper to take to your doctor, to take to your cardiologist friends. It goes over the cholesterol issue, which is so important. And I came out with this paper not too long ago, which does tell this whole history. And one of the things that's in this paper is this little nugget, which comes from emails that we obtained through Freedom of the Information Act of this woman who had been the vice chair of the guidelines in 2015. There's no magic or data for the 10% number or the previous number that we used. In other words, we just pulled it out of thin air. And now let's fast forward to so the guidelines are updated every 5 years, right? This is the most recent review on saturated fats that they did for the 2020 guidelines. I went through, this is my spreadsheet of all the studies that they reviewed, okay? So look at the column in pink. Those are the percentage of studies that do not support a cap on saturated fats. They found that saturated fats had no link to any of these outcomes: cardiovascular endpoints, mortality, CHD, myocardial infarction, stroke. Look at those numbers. I mean, you know, between 73 and 100% of those papers do not support their conclusion that saturated fats have any effect on any of those cardiovascular outcomes. And yet, when they did their report, they concluded the evidence was strong. So they're denying their own data. Well, what about dietary cholesterol? You know, we've been avoiding shellfish, the egg yolks, egg white omelets, we all love those, and for a very long time. Well, there are no more cholesterol caps in the guidelines, you just haven't been told it. So they were dropped by the American Heart Association in 2013 because in tiny print deep within this paper you can find the words insufficient evidence. And they were dropped by the Dietary Guideline Committee in 2015 because they did a review and they said there's no relationship between the consumption of cholesterol, what you eat, and the cholesterol in your blood. They couldn't find a link. But they didn't tell anybody that. And again, they reviewed the topic again in 2020. And they said there's insufficient evidence to link the cholesterol you eat to the cholesterol in your blood. Again, so what did they say in the 2020 guidelines? Any guesses? US dietary patterns are lower in cholesterol. What about the low-fat diet and I put that in quotes intentionally, the low-fat diet is also gone from the guidelines. And again, you haven't been told. Although, again, Alice Liechtenstein, who's our inadvertent truth teller, came out and said there's no conventional message to recommend low-fat diets. She said this in a meeting, which has now been erased from their website. And what did they say in the 2020 guidelines? Well, they decided to scrap all their own reviews on low-fat, and they shifted over to an evidence, a standard set by the National Academies of Sciences, which only allows fat to be in the 20 to 35% range, which is a low-fat diet. So we still have a de facto low-fat diet, even though the words low-fat, they've tiptoed away from those words because all the clinical trials showed the low-fat diet didn't work. And they also wrote in the report some interesting commentary. They said they are not recommending low-fat, or they said they're worried about low-fat because it could engender an overconsumption of total calories in the form of carbohydrates, resulting in adverse metabolic consequences of high carbohydrate diets. Interesting. And further, the possibility that overconsumption of carbohydrates may contribute to obesity cannot be ignored. That's what I call people covering their... and indeed, that is what happened. I mean, that is what happened in America with the low-fat diet. If you look at our shift, and this is another repeat of a chart I showed you earlier in a different way, but we have all the calories, all the excess calories that we now eat are, or the vast majority of them are carbohydrate. So this is not just my analysis. There's now, and this is the work of the Nutrition Coalition, which is a nonprofit that I founded. We now have reports from the National Academy of Sciences. We got Congress to mandate and fund these reports by the National Academies of Sciences, and they have concluded that there are major flaws in the methodology of the guidelines. So this is a report that came out in 2017. The guidelines fall short of meeting best practices for conducting systematic reviews, and the methodological approaches need to be strengthened. Overall, they said, to develop a trustworthy dietary guidelines, the process needs to be redesigned. And it gave 11 recommendations to increase the scientific rigor and improve transparency. Did that happen? Not yet. But we have 2 more National Academies of Sciences reports, also mandated and funded by Congress, who's very aware of this issue. And they say, and this just came out earlier this year, saying the guidelines process it still needs reform. So we now have like a pretty serious body of literature behind us from the highest scientific authority in the land saying the guidelines need fixing. There's something wrong here. Let me just tell you a little bit about low carbohydrate diets in the guidelines, because this is an interesting story, and maybe you're wondering why they aren't there. Well, these are all, what I'm going to show you are a series of emails that happened that we, again, got from Freedom of Information Act requests, and this is a series of conversations. This S2 members is the group that's supposed to refer, that's looking at the dietary patterns. And this is from a staff person at USDA. As you know, there has been a continued and perhaps growing interest in low carbohydrate diets. And we have been asked on numerous occasions why the dietary guidelines do not recommend low carbohydrate diets as the dietary pattern of choice to the general public. So they certainly know it exists. Well, somebody responds, we didn't think to ask a question on that. And the response is from somebody on the guideline committee, the outside expert says, actually, we did conduct a review on low carb, but we just decided we were going to put it in the methodology section. What the results were, which, the methodology section is not the results section. You're supposed to put the results in the results section where it can be acted upon. And this was the systematic review that, again, we got through Freedom of Information Act requests. They looked at 43 studies, including 30 clinical trials. This was back in 2014. Well, one of the members of the expert committee, Frank Hu, he's from Harvard Department of Nutrition. He speaks up, and he says, given the popularity of a low-carb pattern and the enormous amount of research that has been generated in the past several years, in 2014, I was wondering if we should have a separate section on low-carb rather than burying it in the methodology section. And that, my friends, is where the email chain ends, because somebody called up Frank Hu. His last quote. People who are familiar in the field may complain that we gloss over recent evidence and don't give low-carb diets the sufficient attention they deserve. So what did the 2020 guidelines do? They actually studied low-carb, but they could find no studies. 0 studies. They looked for them but couldn't find them. Apparently they forgot the 43 studies they had found 5 years earlier. Now there were no studies. For the next dietary guidelines that have just begun this process, they didn't even propose a question about low carbohydrate diets. And we organized a write-in campaign, and 77% of the comments that went in to address, it was a comment period for about a month in March, 77% said we want a low carb question in the dietary guidelines. That is advocacy power. How many of you wrote comments? Woohoo! Good for you. Well, and we were recognized in the first meeting of this 2025 process, where they said most of the comments that came in was low carbohydrate diets. And so I want to just urge you, there's a new comment period, and the comments go directly to the outside Dietary Guideline Committee, and you can write in another comment. I know you feel like you've done it, and you shouldn't have to do this all the time, but we just have to keep at it. So you can just cut and paste your comment from before. This one will go straight to the committee. You can go to the Nutrition Coalition and just go to the blog post. It's the first one on our site. So I urge you to do that. And again, another thing that has come about because of our advocacy is that we have been pointing out relentlessly that the dietary guidelines are only for prevention. They're not for treatment, right? They're not for treatment of people with diabetes, heart disease, obesity. And so it really shouldn't be applied to the whole population. Well, in this meeting that just occurred, a HHS official got up and said, and acknowledged the dietary guidelines are not intended for clinical, I can't read it, but clinical guidelines for treating people, basically. And that is, doctors, you should take a slide, or any practitioner should take this picture, and when somebody tells them, you need to give your diabetic patients the guidelines, you tell them the guidelines are not for people with diabetes or obesity or any other condition. So why are our experts misleading us? I mean, this is really a big question that I have written and thought about a lot. There's obviously the question of cognitive dissonance. People who have trained their whole lives, written their whole lives on the low-fat diet cannot imagine something else. There's also just the general sclerosis that happens in bureaucracies. They're inimical to change. It's very hard for them. They don't want to have their trouble mistrusting them. And then there's corporate influence, which I just want to spend 2 minutes talking about. This is a paper that we did, I was an author on, where it's the first ever review of conflicts of interest on any dietary guideline committee. What do we find? 95% of them had a tie to a food or pharmaceutical company. 60% had 20 such conflicts. One woman had 152 conflicts. She must be going all day long to industry meetings. If you want to learn more about this paper, you can go to our website, and we have the whole spreadsheet of all the conflicts, and we have these great searchable maps where you can search people's conflicts. You can see nodes. You can see which companies have the most people on their payroll. The USDA, which is the main agency that runs the guidelines, also has over 100 corporate partners. This is just a snapshot of some of them. They work closely hand in hand to work with them, and that results in things like this. These are foods that are fed to kids at school lunches. This is, PepsiCo has a whole website where they have healthy foods for kids. And, Dora the Explorer, that is on the WIC program. The Women and Infant Children food baskets include Dora Explorers and Frosted Mini Wheats. And all of that is because the guidelines, the USDA has corporate partnerships. They are marinating in corporate relationships. Here's another paper that came out recently that is on the Academy of Nutrition and Dietetics. They are the body, they certify 100,000 nutritionists and dietitians, and a very influential body. They were found to own stock in Pepsi, Nestle, and Pfizer. They all together took millions from Hershey's, Coca-Cola, PepsiCo, Unilever, Best Food, Kellogg's, General Mills. And this is from a 2014 email. I personally like PepsiCo and do not have any problems with us owning it. I personally would be okay if we owned Coke stock. These are our nutritionists and dietitians. Again, corporations, there's something called corporate capture, and I think that's what we're seeing here. So all of this brings us back to the Tufts Food Compass. And this is another chart I did. I just want to point out to you more fun things. Chocolate-covered almonds, one of the healthiest foods on the planet. Planters peanut bar, Frito corn chips, nut roll, that sounds good. I'm happy I can eat more of that. Reese's peanut butter cups, have those over an egg, or ground beef. Dr. Mozafarian, I urge you to read that Substack piece. There's a lot of information in there. He's very close to the food industry. Maybe that wasn't always so, but now he is. He's run a food as medicine conference that has a series of conferences across the country where he's consistently, his lead speakers it's him, and C-suite executives from PepsiCo, Nestle, and Unilever and Danone, which are some of the largest food companies on the planet. He's been on the scientific advisory board of Unilever. He runs a center on seed oils funded by Unilever, and those are some of his other conflicts of interest. And Tufts has a Nutrition Innovation Council. This is his school of nutrition. I don't know if you recognize any of the names on there, but they look a lot like names that are on the food compass. So there's no evidence of any quid pro quo there, but you can see that there is a real fusion of corporate interests and academic medicine. The food compass, remember we thought that was kind of a joke, it is being considered as, by the FDA, this is a slide from Mozafarian, to be used in our government's food labeling program. And just one more chart, and then I'll be done, Jeff. One of the other dangers, it's not just junk food that's in the food compass that is ranked so highly, but I think another real threat to us all, which is that fake foods are being promoted over real foods. Just look at this. So the almond milk, okay, unsweetened in chocolate is up there, 95. Here's whole milk down there. Here's meatless chicken, breaded and fried. So that's fake chicken. Here's real chicken. Here is meatless meatballs, more meatless stuff, and there's ground beef down there. That's the highest ranking beef I could find. Ironically, you can eat opossum or ostrich or beaver or bear. I don't even know how those got into his system over ground beef. Make sure you have beaver next time. But even better than that is your Reese's peanut butter cup. Okay, so Tufts has funding from Beyond Meat and Plant Power Ventures. They received a $10 million grant from USDA to develop cultivated meats. And they have an entrepreneur fellowship whose program is aimed to remove all animals from the global food system. Mozafarian says the controversy over his compass is exaggerated and fears it can be weaponized by the food industry. Who is spouting the words of the food industry here? Who is weaponizing the food industry? I don't think it's me. So I want to just end on this last slide, which is about how to fight back against the obvious corporate powers that we're up against. And one of them is to join together in social movements to foster collective solidarity and fight together. And I just want to make a plea to everybody out here. There are things we disagree about, but there's much we agree upon. Ultra-processed foods should not be in our food system or should not be, given to our children in our food system. And everybody, I think, can believe that we should be eating far fewer carbohydrates than the 50% that is advised in the guidelines, maybe 25% or less. And wherever you are in that range, and whatever protein you want to eat, or however much other fat you want to eat, but let's agree on a few things and really come together and create change. I really believe that we have to come together as a group to create change. And please sign up at the nutritioncoalition.us to be on our website, donate, and we'll be sending out all kinds of announcements about how you can participate in change. Okay, last slide. Remember, good nutrition is rocket science. The difference between this and this is something you don't know, so you need to ask an expert. Our experts are here for us. Thank you very much. Thank you. Thank you. Thanks.